Hello, HCISD. As we prepare for the opening of schools this fall, we are taking the opportunity this morning to have a conversation with our local health authority, Dr. James Castillo, to have some conversation around COVID-19, where we stand, and how we will use this information to guide our work in ensuring the safety of all of our students in our school district. So Dr. Castillo, good morning and thank you for being with us.
Thank you so much.
So I wanted to have a little bit of a conversation and inform our parents a little bit about where we stand with COVID-19. Obviously, we are not completely over this pandemic, and so we wanted to hear from you some of the latest information that is available that can help guide us as a school system, but also guide our families as they prepare to return our students to our school system. So if you don't mind, I have a few questions that I'd like to ask you that we've been hearing from our own families. And so we recognize that there are vaccines for our 12 and older students and adults, but there isn't a vaccine currently available for children under the age of 12. So can you talk to us a little bit about when do we anticipate the possibility of a vaccine? And then any recommendations that you have for our families of our young children that will be returning to school?
Well, great questions. Just to start off, I'm also a dad, and my daughter is an HCISD, and she'll be going into 6th grade next year, and she's 11 years old. You know, so she's not eligible for the vaccine that's out there right now. You know, she did virtual learning last year, and I could, you know, I'm definitely there along with other parents and having lots of questions about what's coming this year. And one of the big questions is, what about the vaccine? So if my daughter was 12, I would definitely have her vaccinated right now. You know, we don't anticipate a vaccine for the under 12 group until sometime in the middle of winter. Between the ages of 6 to 11, they're currently doing clinical trials. The FDA is wanting to make sure that this is a safe vaccine. That it offers advantages to the children in terms of protecting them from this illness and exposes them to as minimal risk as possible. So they're being very, very careful in how to authorize this. And so the studies might take until the middle of winter or maybe longer.
Okay. And so what would you recommend for our families that are going to be returning their children to our school systems?
So we need to use all those tools that we've learned about. Today's July 28th, 2021. And I want to put that date because I know a lot of the frustration is we keep changing the rules. We keep hearing all these new things, and it seems like we're flip-flopping all over the place. But that's how science works. You know, we learn, we have to adapt. If we were wrong, we need to learn from that and change what we do. This virus, though, also is changing. It's changing. It's learning how to adapt. It's becoming more contagious, and that's where this Delta variant is. So when we see the virus change and we start seeing the data change, we have to change our guidance. So what can we do? Good news is the vaccine works. So the more of us that are vaccinated, the less of this virus circulates, the less chance of getting exposed to this virus. So the first thing that we can do to protect our kids under 12 who can't get the vaccine is for everybody who can to have the vaccine. So if a parent wants to protect their child, they should be fully vaccinated. And we're very lucky to have that opportunity locally. If you go to vaccines.gov, you can look up all of the locations throughout the county, pretty much every pharmacy around, that you can find which vaccine you want and go get it. And go get it. That's the best thing you could do right now to protect your kids. The vaccine's great, but we need to add more layers to that, especially with this more contagious version of the virus, especially when it's surging in our community. And right now, as of today, we're in a high transmission period again. We were at a low right before July. We were at the lowest we had been in a year. And things looked great, and we were getting back to normal. And it felt good, but now it's surging again. So kind of look at it like the weather. Weather's getting stormy outside. We got to do something to protect ourselves. So here come masks again. So the CDC yesterday just issued guidance saying, when your community is experiencing a surge of COVID, it's time to put the mask back on, even if you're vaccinated, even if you're vaccinated. And for some people, it seems like we're changing the rules, we're, moving goalposts. Well, again, we're adapting to the virus is adapting to us. We want to beat this thing. And while the vaccine is great, if you've been vaccinated and you do happen to get COVID, because it's not perfect, you'll be less contagious than the person who's unvaccinated, but adding a mask to that even improves the chances of it you're not transmitting even more. So that's where I think that guidance has come from. And so when we're going to be looking at schools, how does this apply to schools? We want to keep the kids safe. Nobody wants COVID. You do not want to go through this illness. If you can avoid it, absolutely avoid it. This is not something you just want to get it over with, because the virus is very unpredictable. What it's going to do to you, you can't know going into it. So you want to avoid it. So what can we do going into schools? Masks. That is the tool we can use right now inside of schools to protect everybody. And even if kids don't get very sick from it, I think there's been 300 pediatric deaths in the United States. There's been 16,000 admissions to the hospital in kids, so it's not totally benign. But the biggest impact I think it's going to have to most kids is, one, it can expose their family. They could bring it home. And with the Delta variant, that it's more contagious, we're not sure what role kids are going to play in this. That we don't know yet. But two, it's going to disrupt their school. It's going to disrupt their learning. If we're having outbreaks in schools, if kids are having to miss school, that's going to disrupt their learning. So adding masks to the school environment is just going to reduce the episodes of transmission in school. It's going to reduce the chances of kids getting it in school, and we know they work. We know masks work. We've seen how they work. So definitely it's something we need to use in schools.
So, Dr. Castillo, can you talk a little bit more about the breakthrough infections? I think we're starting to hear a little bit more now that certainly a larger amount of population is vaccinated. We're hearing about these breakthrough infections coming. Can you just talk a little bit more about that in particular?
Sure. No vaccine's 100% effective. The vaccine that came out, the mRNA vaccines, there's two kinds that we have available in the United States. The one from Pfizer and Moderna use a technology called mRNA. And then Johnson & Johnson uses a viral vector, an adenovirus vector. Those are all big words for they train our immune system to fight off this virus without ever exposing it to the real virus. Okay. So there's no COVID-19 in these vaccines. It's the code for the spike protein. This is that little crown. The coronavirus gets its name from crown. So it's that key into our body. That's how this virus enters our cells. And we train our immune systems to block that key. If it sees it, to grab it. And when they tested those vaccines out, they can be anywhere between 95% effective to 70% effective from even catching COVID, which was great. I think we were hoping for more than 50%, and now we're way up there. It definitely works great about preventing death. It definitely works great to keep you out of the hospital, but again, nothing's 100%. But against having no vaccine, it's amazingly effective. What seems to be changing, though, is as the virus adapts, can it protect you from catching COVID at all? And that's that breakthrough infection. And we're starting to see more of that. Most people in some countries are vaccinated. And so they're seeing infections in people who've been vaccinated, but what they're not seeing is deaths. 99% of deaths in COVID, or excess of 99% of deaths in COVID that we've had since the vaccine's been available, has been in unvaccinated people. So it's holding up great. Hospitalizations, the vast majority of people in the hospital have one thing in common: no vaccine. So that's holding up. What may not be holding up so good is, do you get COVID at all? But it's protecting you against the worst parts of this illness. So even though there's breakthrough infections, it's still doing what it needs to do to protect us against the worst this virus can do to you. So even though, you can still potentially get COVID, you might even spread it, and here we go with the masks again, right? You're less likely to spread it. You're less likely to catch it. You're much less likely to be hospitalized, and it's almost it's very, very rare to have death on the table as an option if you do get COVID.
And so we talked a little bit about our children 12 and under, but there is a vaccine available, obviously, for our children 12 and over. And so how safe is the vaccine? I'm sure that's one of the biggest questions that parents always have. How safe is it for our children? You know, it's obviously still in discussion on the 12 and under, but for our 12-year-olds and above, how safe is the vaccine for that population? And what are we seeing? I don't know if you have any kind of numbers, but in terms of what percentages of our children 12 and older are being vaccinated?
So the only vaccine available for the 12 to 18 age group right now is actually the vaccine from Pfizer. So this is 2 doses of mRNA given 3 weeks apart that, again, trains your immune system to recognize that spike protein and block it. The vaccine is much safer than catching COVID. We need to start with that. And unfortunately, it looks like this virus is not going away. If you remain unvaccinated, eventually this virus is going to get you, right? And it might do nothing. It might be asymptomatic. You might get a little cold. You might get real sick. Some kids get this immune system reaction even after they had mild COVID that can put them in the hospital weeks later. It's called MIS-C. Very rare, very rare. But the complications of the vaccine that we're seeing has been myocarditis or inflammation of the heart, also much rarer than those rare problems from the disease. So there's always risks associated with any medical procedure, but you have to balance that against the benefits. And the benefits are clear. This virus is more dangerous than the vaccine. The vaccine is way safer than getting COVID. And the idea that, well, I'll just never get COVID, unfortunately, that's not going to be reality. So right now in Cameron County, almost 50% of people 12 to 16 years old have already received 1 dose of the vaccine. So that's great. But there's this other word out there called herd immunity, and the idea that I don't have to get the vaccine because everybody else is going to get it. This virus is so contagious that we are nowhere near herd immunity. So we need everybody to get that vaccine who can. There might be some people who have medical reasons that say they just can't get it. And so we can all help protect everybody else around us. We can do our part to protect our families, to protect our communities, to protect ourselves. But everybody needs to do their part in this. And as more and more people have gotten this vaccine, the safety profile is holding up great. And we know that this virus is only spreading more, unfortunately. So if anybody's been waiting to see, they want to be first in line for this, a lot of people have already gone ahead, and it's showing to be a very safe vaccine.
So I'd like to revisit masks in particular. Now, in the state of Texas, we are not able to mandate masks in our communities and in our school systems. So we also hear from the CDC making recommendations around masks. So how do we balance that in our communities and in our schools?
Right. The CDC's recommendation really focuses on if your community is having an increase in cases, that you need to use every tool at your disposal to try to decrease the rate of transmission. And masks are one of those tools. So we know that the importance of continuing with in-person education. We know the importance of trying to avoid absenteeism. Nobody wants to get sick. And if we have a tool like masks available, we should use them. What's at stake is so high. What is the harm of the mask, right? Unfortunately, it's become a political statement. There's debate about this. There's questions about why do we keep changing guidance. But take a new look at this. Let's look at what masks can offer. What's the harm of masks? What's the benefit of masks? And it seems to be that masks absolutely offer a benefit to reduce transmission of this virus. School is very important. We don't want kids missing school. We don't want kids getting sick. So we should use this tool at our disposal to help achieve our goals. until we have a vaccine and we reach that level of community immunity or collective immunity or herd immunity, which we're not there yet, we have to use every tool we have. So we have the vaccine, we have masks, we have hand washing, we have distancing, we have quarantine, we have isolation. So we don't want kids who are sick coming to school. If you're exposed, it means that you might be getting this virus. We have to break the chain of transmission. And if we can use masks to help reduce the number of times we have to do that, that's how we're going to keep our kids in school. That's how we're going to keep them safe. That's how we're going to get them educated. Mm-hmm. So that's where the importance of masks come. And in Texas, it is up to us to do what's right. But nobody's saying masks are wrong. We're saying use them. And I really hope people hear that message.
Last question. So you mentioned earlier that your daughter is coming back to face-to-face instruction, as are all children in the state of Texas. Earlier this year, the state removed remote learning as an option. And so all of our students in the state will be coming back into remote instruction. What are your thoughts on face-to-face instruction, as obviously your daughter will be experiencing?
Yeah, the American Academy of Pediatrics, who's also recommending masks for everybody 2 and over, also recommends face-to-face instruction. We know that it's the best for our children. You know, my daughter did virtual, and you know, it's challenging. It's definitely not going to offer the best level of education that we can give in person. So we know how important it is to go back face to face. You know, I can understand the anxiety that a lot of parents have after a year of potentially being on virtual learning, but we know the benefits are there. And if we can do everything possible to allow our students, our children, to have that face-to-face experience and to continue their education, and use all those tools, vaccine, masks, you know, social precautions, everything. You know, we can't wait any longer. We can't. We have to do this for our kids.
So Dr. Castillo, I want to thank you for spending this time with us in an era where a lot of people get their information from the internet and Facebook and all these various other sources. I appreciate your time in hearing from our local health authority in this area and really keeping our community and ourselves as a school system informed. So again, thank you for your time this morning.
You're very welcome. Thank you so much.
Thank you.